What's up everybody, selamat sejahtera, selamat tengah hari. Dr. Rolin here daripada Sky Clinic. Hari ini 31 hari bulan Mei 2023. Topik perbincangan ialah berkenaan dengan World Health Assembly dan apa perbincangan WHO. Saya terpaksa tunggu lama, hampir 9 hari untuk buat review ni berkenaan dengan apa update tentang International Health Regulation 2005 yang sepatutnya kena buat amendment pada perjumpaan ni. Namun tak berjaya, tapi disambung lagi 12 bulan untuk dibawa berbincang. So I'm just gonna go more of the snipping kepada apa discussion yang Malaysia telah bacakan, yang mungkin ramai tak tahu mana nak cari pun this kind of content. Tapi I akan cuba sharekan the content now. Ada 2 slide yang nak share. Pertama sekali, I nak show to you the discussion yang Malaysia bacakan berkenaan dengan IHR tu di persidangan WHO. So first, let's go to that one first. I nak play video, direct access kepada WHO punya website. So, we can get to this.
Thank you, Delegate of Samawam. Now the floor to Delegate of Malaysia, Delegate of Para.
Thank you, Madam Chair. Malaysia is not thanks to 14.1 and 14.2. In terms of human resource, we note that the IOAC encouraged WHO to make further efforts to improve gender balance in senior positions. It is unfortunate that women represented only 38% of the workforce in senior positions. Additionally, IOAC mentions that there is a high number of short-term contracts and has recommended for WHO to review the policy, move towards a 12-month minimum contract. We concur, as this would provide WHO staff with the security and stability they need. Malaysia acknowledges the constant support by the Secretariat in the provision of structured technical approaches. Malaysia believes the working group on IHR has provided the best platform to achieve consensus among member states on the negotiated proposal for amendments. We have been actively supporting and participating in the series of working group meetings, as these proposed amendments will definitely enhance our existing IHR 2005. This would include delivering equitable access to appropriate health services, ensuring continuity of services during major public health emergencies, effective community engagement, and timely risk communication, strengthening and maintaining point of entry capacities of early detection of diseases, and timely managing the public health emergencies are very crucial. In reference to 15.1 and 15.2, Malaysia takes note on the report of the Director General on strengthening the global architecture for health emergency preparedness, prevention, response and resilience. Malaysia commends the Pandemic Fund, as this is an innovative mechanism to strengthen HEPR in developing countries. We reiterate the importance of strategic partnerships and collaborations where WHO and partners have provided intensive support for eligible countries to develop food proposals and to implement their projects. The implementation of Malaysia's strategy for emerging diseases and public health emergencies, which is based on regional upset, has shaped and strengthen the country's robust healthcare structure to prevent, prepare, and ensure rapid response to public health emergencies. Global health security and the threat of chemical, biological, radiological, nuclear, and explosive (CBRNE) incidents are major concerns. The level of knowledge and resilience is closely linked to CBRNE preparedness. Hence, initiatives to enhance CBRNE preparedness will heighten awareness, readiness, and the ability of the Malaysian Ministry of Health to manage CBRNE hazards, particularly those with national or international implications. Pandemic preparedness and other health emergencies planning efforts require whole of government and whole of society approaches, not limited to health ministries and health sector related agencies. The gaps in health security that have been identified and reported are to be used to guide the planning of our respective national action plan for health security. Malaysia remains committed to strengthening health security at the national and regional levels. We will adopt a comprehensive and flexible holistic planning approach tailored to our national context. Thank you.
Okay, so itu statement pada Malaysia punya ni. Saya pun tak tahu siapa yang baca ucapan tu, mungkin staf kerajaan ataupun staf pada Kementerian Kesihatan. Okay, so one thing interesting yang Malaysia highlight, they agree to certain reasons of the IHR. Memang everybody will agree untuk amendment, tapi amendment tu kena tepat dengan ketetapan dia lah. Tapi yang sangat menarik is Malaysia punya state speech tu berkenaan tentang CBRNE, chemical, biological, radioactive, nuclear dan juga explosive. Macam satu negara macam memang tak ada senjata-senjata ni, tapi kita risau. Okay, so that is also technically in the new form of pandemic, of future, of emergencies and everything. Kita pun kena bersiap sedia. So Malaysia ada foresight sedikit dalam bab-bab tu, nampak gayanya bagus. Tapi dari segi perspektif of whether we agree to the IHR, kebanyakan negara-negara kecil akan agree kepada IHR tu because dia sangat membantu, because dia pergantungan kepada teknologi, information, scientific data and everything. Kita banyak sangat bergantung pada negara-negara yang lebih besar, lebih maju. So it's just that certain context saja, whether kita ada isu di mana kita tak boleh buat pilihan sendiri yang akan jadi the issue dalam the new discussion of the implementation of the IHR. So setiap negara akan dibekalkan waktu macam 5 minit macam tu untuk bentangkan dia punya usul dalam WHO tu. So meeting dia hampir ada 9 meeting. Hari-hari ada meeting. And kalau siapa yang nak tengok this thing, senang saja, I tunjuk you. You boleh pergi kepada website WHO and then search saja 76 World Health Assembly, and you boleh pergi kepada Watch World Health Assembly Sessions, and then sebelah kanan dia ada all plenary Community A dan Community B yang melibatkan komiti berkenaan dengan International Health Regulation Amendment semua ialah Community A. So Community A ni setiap meeting dia ada ni. So Malaysia punya meeting tu berlaku pada Community A meeting 23 hari bulan 5 2023 antara jam 8 malam sampai 11 malam dekat Geneva. Okay, this was thing done. So all the recording semua ada. Okay, so you can pergi tonton negara-negara lain, apa komen, apa view negara-negara lain semua boleh dapat. Tapi I just want to show Malaysia punya ni lah. Okay, and then untuk conclusion semalam, so pada hari tu lepas semua negara-negara telah bagi pendapat everything, mereka decided tak ada voting. Mereka decided tak ada voting dan akan dipanjangkan pada hari penghujung. So bila hari penghujung, the Director General of WHO dia pula dapat pentas untuk share. So I just want to show this a snip of dia punya his address berkenaan dengan IHR tu. So you can listen terus daripada mulut dia sendiri. Saya pasti kebanyakan konten ni takkan didedahkan oleh mainstream media because of unknown reasons. Kita pun tak tahu kenapa mainstream media tak tahu benda, sedangkan ni satu event yang sangat-sangat besar yang berlaku dalam dunia persidangan kesihatan. Okay, so let's just go straight away to ni. You can see ni ialah yang paling last kali, 9 plenary meeting berlaku semalam tengah hari. Okay, so I just go straight to the discussion. Salah satu benda yang mereka telah approve is peningkatan budget WHO tahun ni naik lagi 20%. Okay, and let's go to the thing and listen daripada dia sendiri.
Prevention, emergency, critical and operative care, food micronutrients, indigenous health, infection prevention and control, maternal and child health, medical oxygen, primary health care, refugee and migrant health, rehabilitation, traditional medicine, and more. The approval of the budget for 2024-25, including the 20% increase in assessed contributions, is very encouraging and the next step in the direction of a stronger and more effective and empowered WHO. We also appreciate your support for the idea of an investment round, and we look forward to working with member states further to bring that idea to fruition. Both the increase in assessed contributions and the investment round are historic and a huge milestone. Thank you so much, and we're very, very grateful for this. Last week's strategic roundtables offered an opportunity to highlight some of the most pressing public health challenges, pandemic preparedness and response.
Okay, so listen from here onwards, very, very important. Okay.
Climate change and health, tuberculosis, immunization, the WHO Framework Convention on Tobacco Control, and health workforce, which is central to addressing every threat we face. This week also saw the launch of the final report of the Council on the Economics of Health for All, with several strong recommendations for how we value human and planetary well-being rather than a crude focus on GDP. I commend the report to you. The year ahead offers several significant opportunities to make substantial progress on all the issues you have discussed over the past 9 days. In particular, the high-level meetings on universal health coverage, tuberculosis, and pandemic preparedness and response at this year's UN General Assembly are major opportunities to catalyze much needed political commitment. Likewise, the continuing negotiations on the pandemic accord and amendments to the international health regulations are an unprecedented opportunity to learn from the mistakes of the COVID-19 pandemic and ensure they're not repeated. Your challenge as member states is to negotiate a strong accord for approval just 12 months from now. This accord is a generational opportunity that we must seize. We are the generation that lived through the COVID-19 pandemic. So we must be the generation that learns the lessons it taught us and makes the changes to keep future generations safer.
Okay, so that is something very, very important yang daripada WHO sendiri. So kita nampak few things, budget WHO sumbangan daripada negara-negara yang menjadi ahli naik 20%, investments is another one more thing that actually present that also increase at this time. And berkaitan dengan pandemic treaty, dia kata shoot back again towards the member state to make the decisions and berbincang lagi 12 bulan lagi to see apa pembaruan ataupun update anything. So this 12 months is good. Kita memang tak berharap mereka akan sign the deal secepat minggu ni sebab telah ada banyak negara-negara, parlimen-parlimen ni, pembangkang atau kerajaan telah membincangkan isu ni secara ketara dan kata some amendments tak sesuai, tapi mereka gunakan nada yang cantik lah, a good command of nice language. They said that the power goes back to the states yang agree to regulate. Tapi kalau the states are being lobbied and the states ada orang yang vote who are not from the parliamentary system ataupun the governmental system, then dia jadi problem. Kita worry satu je, lobbies yang akan vote untuk kita. dekat mana-mana negara pun. So we just need to make sure that doesn't happen, and we hope that our country semua remain wise, celik untuk decide untuk proper amendment and right amendment for kedaulatan negara kita. Okay, so I think I covered a bit from the videos and everything. I hope you guys take note of it. Share kepada kawan-kawan you, jangan lupa share. It's only when you share people get to see and update, because mainstream media takkan cover this kind of content. I had to wait for 1 minggu lebih untuk buat konten ni. Like, follow us. Next week 6 hari bulan Jun saya akan pergi ke mahkamah balik. Kita akan jumpa orang yang paling kita nantikan di mahkamah 6 Jun. Bye bye.